Hello and welcome to the University of Chicago Medicine at the Forefront Live. We're excited to host these programs to allow you to interact with our experts. UChicago Medicine has some of the leading researchers and scientists in the world who are here to help. So get your questions ready. We'll answer as many as possible over the next half hour. Now we want to remind our viewers that our program today is not designed to take the place of a medical consultation with your physician. Are you looking for tips to prevent common fall sports injuries? Wondering if it's time to see a doctor about that knee that's been bothering you? You came to the right place for answers. Joining us today is UChicago Medicine's Dr. Aravind Athiviraham. Dr. Athiviraham is an orthopedic surgeon and specialist in sports medicine. He's also one of the team doctors for the Chicago Sky. Welcome to the program, and tell us a little bit about yourself and your areas of interest and expertise, if you will.
Yeah, thank you very much for having me. So I've been at the university for 4 years now, and it's been a pleasure. And a little bit about myself. So I specialize in sports medicine. So common things I see would be knee and shoulder injuries. So things like ACL injury, meniscal injury, kneecap dislocations. For shoulder, often I'll see shoulder dislocations or rotator cuff injury. Those would be some of the more common ones I'll see. Yeah, taking care of the Sky has been a phenomenal experience this year. And unfortunately, they didn't make the playoffs this year, but we're hoping for a great showing next year. But it was a pleasure to meet all the athletes, and working with them and taking care of them was definitely an honor.
Yeah, it's really a great bunch of women, and a lot of fun to watch them play and interact with them, be around them. Just nice folks. So it's got to be very rewarding. Now remember, as you watch, you can ask our expert questions that are of interest to you. So start typing, and we'll try to answer as many as possible. We'll get off to our questions right off the back. And the first one is, what is the most common injury you see related to fall sports?
So for football, probably the biggest one that I see is ACL injury. Often it'll be it could be either a contact or non-contact injury, depending on the mechanism. Patients will often present with a pop and swelling and giving way in their knee. That's probably the most common one that I see. Kneecap dislocations can happen, and as I mentioned, shoulder dislocations, where it's associated with a labral injury to the shoulder, can happen as well.
Now you mentioned some of the knee injuries. I think the concern that a lot of people would probably have is they get an injury like that, they're on the field, they don't realize how serious it is, or maybe is not. What should people look for, and if you think you're hurt, particularly with your knee or something along those lines, what do you do?
Yeah, so the first thing, when there's pain involved, it's important to know whether or not they can weight bear on the knee. So right away, if they're having difficulty putting weight on that knee, that indicates a certain level of severity. The other thing is, if the knee swells up significantly, that's a way of the knee communicating with you that there's something really serious going on. So that can indicate, as I mentioned, a ligament injury like an ACL or a meniscal injury. Sometimes it can turn out to be nothing, just a really bad bone bruise. But I think if you're starting to have difficulty weight bearing, swelling, sensation that the knee is giving way, they don't trust your knee, all those are signs that you may need to get that checked out.
As fall hits us, the weather starts getting nice, it's cool, and a lot of folks want to start running. How does somebody pick the right pair of shoes if they're going to go out and start running?
Yeah, so I'd say probably the biggest thing is pick one that's comfortable for you. Some things to keep an eye out for would be more flexible shoe that's lightweight. You certainly don't want to be running with a lot heavier shoe. You want something that has good cushioning. Running shoes tend to be more cushioned in more of the heel area. Also focus on the heel area. You want something that's comfortable for your Achilles tendon in your heel. So for example, there's often a cutout for the Achilles tendon called the Achilles notch they want the shoe to have. And the ankle collar, what wraps around the ankle, it needs to be well cushioned as well. So those are some things that you can look out for. But I would say try it on, use it, at least in the store, and really try to get a sense of it. And that's probably the best way. But those are some tips.
I had no idea there was actually a name for that little notch at the back of your shoe. So
yeah.
Now I know that. So here's a question: I run 3 or 4 times a week. How often should I replace my running shoes?
The surprising thing is running shoes don't have an expiry date on them. So there's some studies that show that the running shoes can last up to like 600 miles, and that's even a subjective thing. So, with the the people that are knowledgeable, that sort of feel would say would be that if the shoe stops feeling comfortable, that's often the time to replace them. So. If you're running and the shoe's comfortable, you don't have to just replace them because it's a brand new year. But if you're trying to wear them and it's definitely something's not feeling right, there's a little more pains in areas that you normally didn't have pain in, or there's definitely a lot of areas of wear on the sole of the shoe, those are things that you should look out for. So if you're running and you're thinking that while you're running that, oh, should I get a new shoe? Then you probably should.
So what are shin splints? I'm curious, and how do you know if you actually have them?
So there's kind of two different categories of what people related to shin splints. So, the one of the shin splints are medial tibial stress syndrome. So basically, it's kind of an earlier version of a stress fracture. So this is common where a person's been inactive for a period of time and then starts to really ramp up their activity. So sometimes we see that in like military recruits, things like that. And this is more on the inner part of the distal tibia, so the medial distal tibia, which is the leg bone, and occurs with primarily weight-bearing activities. And if you have pain in that area, it's more bony related. Again, it could be like an early form of stress fracture called stress reaction syndrome. So that's one form of what people could call a shin splint.
So is it mainly pain on the front?
Yeah, front and inside. That's
okay.
that's for the stress syndrome. The other one is a little on the side, more lateral, anterolateral, where over the muscle belly. Mm-hmm. And this is more along the spectrum of what we call exertional compartment syndrome, which is basically when you're putting weight itself, it doesn't bother you, but when you start to run or really overexert that compartment, it really feels really tight. And again, there's kind of different spectrums of this. But that's more in the spectrum of what we call exertional compartment syndrome. So the treatment for either of those are fairly different.
So as far as preventing shin splints, what's the best advice you can give?
So in terms of preventing, it depends on the mechanism. So for bone-related shin splints, the stress syndrome that I talked about, you want to kind of ease into activity. So you don't want to start from like 0 to 100 right away. You want to kind of, if you want to train for a marathon, for example, I wouldn't recommend going from not running at all to training with your friend that's done this for the last 12 years. You really want to build up to the point where you can do that. For the muscular exertional compartment syndrome type shin splints, which is more muscular on the outside, you really want to stretch the muscular compartment. Things like foam rollers can really help stretch out the muscle fascia there to help reduce the incidence of that.
Any tips to get them to heal faster?
Again, just relates with, I'd probably say prevention is probably the biggest thing, but in terms of if it's a bone-related shin splints, I would probably, to be safe, probably see a physician just to make sure it's not a stress fracture. If it's a muscular-related variety, I would, again, use the stretching and the foam rollers to try to get it to heal faster. But that one's a little less urgent in terms of, you can try to work that out a little bit before going. The bony one, I would, just to be safe, to make sure you don't need to be need further intervention like crutches or a boot, just to see a provider for that.
We're getting some viewer questions in, and I want to make sure we hit those. And I also want to encourage our viewers, if you do have any questions, please type those in. We'll try to get to as many as possible as we can during the program. John asks, what's the best way to treat swelling in the knee after running?
That's a great question. So in terms of most swelling, this goes for swelling in any joints. I would say, we term it the RICE protocol. So, the R in the RICE stands for, rest. I stands for ice. C stands for compression. E stands for elevation. So, I know it's kind of familiar to everybody, but, if it's just kind of an off and on thing, ice the knee, wrapping up with an ACE wrap, or even, you can get from a pharmacy a compression sleeve. All that can, help alleviate some of the swelling. Sometimes if it's really severe, you might want to take some anti-inflammatory medications, as long as you don't have stomach problems. All that can help as well.
And again, kind of along the same line as my question earlier, if you have that swelling issue, how do you know that it's, you have to be cautious, obviously, and how do you know that you're to that point where you can take care of it with the RICE method, or you actually need to go see someone like yourself?
Yeah, so if it's associated with an injury, for example, if it depends if it's what we call an acute injury, which is something that specifically happens, you can associate with that injury, or more of a chronic condition where every time you run like 10 miles, it starts to flare up. So that's really different. So for an acute injury, which we talked about, for example, the athlete playing soccer or football, where they suddenly feel pop and swelling, that's a lot more concerning than a runner that, they know that after a certain amount of mileage, they're going to feel a little bit of, pain and swelling their knee. That's really different. So I'd say for the former, the acute injury, I'd be more aggressive about, seeing the physician right away versus a more chronic condition where you know your limitations, you know what to do, you've been doing that for a while. As long as you know how to manage that for yourself and you've tried the rest ice compression elevation protocol, I think it's okay to wait a little bit longer before you see a provider for that.
Now, Alexis has a question. Apparently, she had knee surgery. It's not getting better. Been to physical therapy for years and just really struggling with it. Any advice?
So it depends on, so knee arthroscopy is done for a variety of different pathologies, for the knee. Often, I would say the biggest pathology that we do it for is, meniscus pathology or meniscus tears. And depending on the individual's age, it's not just restricted to one thing. There's also some cartilage injury that comes with that. So, when surgeons perform a procedure for a meniscus, often they're able to address the meniscus well, but the arthritis, we haven't discovered anything yet that will regrow cartilage to a great extent. Like there's no injection option that will magically make cartilage kind of grow back to where it was when people were once 20 years old, that sort of thing. So, so from that standpoint, I would say again, I don't know your individual condition, but I would say for the most part, let's say you're through the immediate recovery phase. I would say definitely by 3-4 months, most people start to feel good, and by 6 months, I would say most of the recovery is done from a knee scope. Then you start thinking about, okay, was there some arthritis in the knee that could have contributed to the pain? So that could be the scenario there. But in terms of trying to deal with it, again, it's a difficult problem. Again, assuming that it is related with the arthritis, anything to do with core strengthening of the knee, so working on the quad strength, all that can help. Again, if the pain's really bad, things like anti-inflammatory medications can help as well. But those are all the things that could potentially help. Bracing is a little more controversial. There's no real, depending on the location of the pain. So if the pain's all in the inside, and you want to try to unload a brace, sometimes that can help too. But it depends on the individual, I would say.
Sure. So I think I know who's asking this question. Skip asks, what's the best treatment for plantar fasciitis?
So that's a very good question. And couple of things. One is stretching, like everyone knows, is probably the most important thing. And not only is it stretching, but also the way you do the stretches. So I would definitely search for videos on how to do it properly. So you want to stretch the the plantar fascia such that you're locking the foot, so it's stretching what you want it to stretch. So there's kind of different strategies on that. Again, there's probably videos online they can look to do that. So that's probably the biggest thing. Night splints can sometimes help if the pain's really bad. Anti-inflammatories can help as well.
So what is the specific injury here, though? What is going on?
So it's most likely related with overuse, microtrauma to the plantar fascia, okay. Which is a structure on the bottom of the arch of the foot, and that's what's causing the pain.
I see. So John from Elyria asks, is it accurate that surgery for a meniscus tear is not recommended after 40 because the surgery will increase the onset of arthritis?
So that's, again, a very good question. So there's actually multiple studies on, again, alluding to what we talked about earlier. So in the setting of, significant arthritis, meniscal, treatment of meniscal pathology with a scope is is more unpredictable and maybe less successful. But age is, one thing in the equation. What I would say is, depends on, the acuteness of the injury, the type of the tear. But yeah, in general, the older the individual with more of a, what we call a degenerative type tear associated with a lot more arthritis, that's less amenable to, knee arthroscopy versus a more traumatic tear where, associated with a specific injury that's associated with what surgeons call mechanical symptoms. So these are things like locking. When you, try to straighten the knee, you can't do that, either permanently or temporarily. You would term that, locking or catching. Sharp, pain on the inside, and again, very localized pain. And if it's an acute injury, again, that could, mean it's a more, acute type tear, or traumatic type tear. Versus again, if it's something that you've been dealing with for a year, and you're a little more, older, and doctor gets X-rays, and you see, significant, narrowing in the joint space, which is what you look for when you get these weight-bearing X-rays, then that's something that's less amenable to knee arthroscopy. So the overall premise of that is correct.
Interesting. So Naviditha, I believe, asks, if your knee hurts while running and you think it may be related to the LCL, how long do you recommend holding off on running?
Yeah, so for any, so the LCL is one of the collateral ligaments in the knee. So the one on the inside is called the medial collateral ligament. The one on the outside is called the lateral collateral ligament. So for any of these, ligament injuries, especially on the collaterals, we're actually pretty successful with treating them non-operative. So that's different than the cruciate ligament injury, which is like an ACL injury, where often, especially in the younger athlete, where you might be more aggressive about pursuing surgical management. For the cruciate injury, or for the collaterals, you can try healing at non-op, and especially if it's a partial, low-grade injury. I would say anywhere between 3 to 6 weeks, things should settle down. Often when the patients come and see me, if it's a higher grade injury, I'll prescribe them what's called a hinge knee brace, which is brace with some supports on the sides with a hinge so that you can still move your knee. And then physical therapy in the usually in the range of 6 weeks. So usually by then things start to feel better, but there's a big wide range depending on the severity of the injury. And
a follow-up on that, low impact exercises during the rehab time, is that, you recommend that or not?
Yeah, absolutely. So, for any sort of, if a patient has a lot of knee complaints when they're doing, running, I would often ask them, okay, how much are they mixing up their, running with other low impact activities? So things like, biking, aquatic exercises, elliptical. I think it's important to mix all that in terms of, getting the athlete to get the cardio that they need, but at the same time, minimizing the impact on their knees. So yeah, I would encourage, especially when you're recovering from an injury, to focus more on those low impact exercises.
Now this one hits a little close to home. Why do my hip and knee joints crack more often as I get older?
So again, there's so many different reasons, for cracking joints. Again, but most often in the older individual, it could be related with some early onset of arthritis, where the cartilage surfaces could be a little more rough, and that could be what's producing that.
I see. And we want to remind people that if you have any questions for the doctor, just type them in and we'll try to get to as many as possible. Next question, when I pull a muscle, should I put ice or heat on it or both?
Again, good question. So what I would say is in the initial period, what I would do is, again, the same thing, the RICE protocol. So rest, ice, compression, elevation. So I would ice it initially. And stretch. Probably not overdo the stretching initially. Maybe some light stretches might be okay. As the inflammation settles down, and again, you can take some anti-inflammatories to help with the initial pain. Once the initial inflammatory phase settles down, then you can start, thinking about, putting some heat on it and being more aggressive with stretching. The risk of putting heat on it too early would be that it could potentially increase the inflammation if you do that too early. So I would say as a anti-inflammatory aid, icing probably initially in the acute period, and maybe down the road, you can see which one works best for your individual condition.
How about stretching the pulled muscle? Does that help, or does that cause more damage?
Again, as long as it's not hurting you too much, at least initially, I think that's okay to do in very light moderation, at least initially. But initially, I would say probably the most important thing is just to rest it, let the inflammation, the pain settle down. And then as things evolve and become less inflamed, definitely try to push the stretching, further.
Alexander has a question for us. As a runner, what steps should I be taking to ensure the health of my feet and ankles before a big run? And is water exercise class a good way to relax those muscles?
Yeah, so kind of like we talked about earlier, I think stretching is really important. You especially want to make sure that your Achilles tendon is not too tight, and there's a variety of mechanisms of trying to do that. Stretching your calf, your hamstrings, I think all those are very important to do. You want to make sure, like we talked about earlier, that your footwear is appropriate and not hurting. In terms of aquatic exercises, I think that's very reasonable. Again, just in terms of low impact activity, that's one form of low impact activity. Other things could be biking and elliptical, like we talked about. But yeah, everything that he mentioned is a reasonable thing.
I am curious about the Achilles just a little bit. As you mentioned, my brother, who's a world-class athlete, I'm joking in case he's watching this, he actually ruptured his Achilles tendon playing basketball and
Yeah.
Snapped it, which
Yeah.
terrible injury. But how do you prevent something like that? Again, same thing,
Right.
stretching and
So again, we kind of term this a classic weekend warrior injury, where
Yeah.
basically, athlete or may not be as active, kind of throughout the course of, the, Monday to Friday or on a weekly or monthly basis, and then suddenly decides, hey, let's play a game of pickup basketball
Be pretty
with my
accurate.
friends, and that's when this happens. So what I would say is definitely ease up into things, stretch it. I think, stretching the Achilles is really important. Certain type of antibiotics, like fluoroquinolones can sometimes predispose people to that, but I would say probably the most important thing, particularly for your brother, would be, definitely stretch beforehand. Ease up into activity. If you know that you have a pickup game with your friends coming up, then really kind of work up towards that. Do a lot of stretches, a lot of activity, in the lead up to that, so that your body's not shocked with sudden bursts of activity. I think all that can definitely help.
Well, a question from Chuck, and he says regarding tibial stress fractures. So 10 years ago, he was diagnosed with one from overuse in a track and a field event that he participated in, and he still has pains in that area ever so often, and he's curious, is that normal, or is that something he needs to be concerned about? Does he need to come and see someone like you?
Yeah, I think as long as he's able to do all the activities that he can do, he's been dealing with it for a while, and it's, I would say no acute progression, meaning that things haven't dramatically gotten worse. I think from his description, I think he's safe to wait. I think it's not uncommon for, minor aches and pains to pop up now and again, but if things are acutely getting worse and to the point where he's having difficulty doing the activities that he normally would able to do, then I would see a provider. Unfortunately, my experience has also been the same, where these stress fractures or stress syndromes can take a while to heal in a lot of individuals, and they're doing everything right. Especially if it's just on the one side. Sometimes for these recalcitrant stress syndromes, we'll often give the patients, crutches to try to even completely offload that area to try to accelerate the healing. A walking boot can sometimes helps as well. Bone stimulators are a little more controversial. I mean, sometimes we use that on, some of our athletes, but often a combination of all the approaches work. But from his description, I think he's safe to wait and just kind of keep work on the stretching and things like that we talked about.
Yeah, maybe it's preparation, a lot of it.
Yeah.
And you've already addressed this, but I want to ask it again because we do have a viewer that popped in that's curious about shin splints, just as far as prevention, just some quick tips there.
Yeah, so again, it depends on, if it's bone related or muscle related. If it's, muscle related, that's more on the outside, then, sometimes foam rollers to really work out and stretch the fascia of the muscle can help. If it's, bony related, again, something that it depends on how much of interference it's causing. If it's something that is really, causing your problems weight bearing, then sometimes just like easing off on the area, protecting your weight, using crutches, all that can potentially help. But for the bony related, because it could be part of the stress syndrome or stress fracture spectrum, I would probably see a provider if you've never seen one. But in general, I would say, just try to be mindful of like overuse. Listen to your body in terms of how much miles you can run before starting to get the pain. But I would say definitely try to distinguish between if it's muscular or bony.
Sure. Here's one: if I pull a muscle, how much rest do I need before a regular workout?
Yeah, so it's a good question. It depends on the severity of the muscle strain. So usually when people talk about pulling a muscle, it'd be in a mild, what we call a mild muscle strain. So for that, I would start off with, like we said, stretching activities, icing, anti-inflammatories as needed. And generally, I would say by about 3 weeks, things should start to get better. If it's more severe, things could take up to 6 weeks to get better. So it just depends on the severity of the pull muscle.
Talk a little bit about shoulders, if we can.
Yeah.
People injure their shoulders a variety of ways: golfing, playing softball, baseball, that kind of thing. Again, when do they need to come see somebody like you?
Yeah, so it's really common for people, to have some pain in their shoulders, overhead activity. We call that often impingement syndrome. So basically, when the person elevates their arm, the rotator cuff can become pinched on the roof of the shoulders, called the acromion. Sometimes there's a bone spur associated with that as well. So again, as long as the patient is able to do all their activities, it's not a big nuisance. Pain is like, I would say under like a 3 out of 10. I think that's fine to keep doing that. Maybe take anti-inflammatories. I think if it starts to get to 4 or 5 out of 10, then you may want to see a provider. Again, if the diagnosis is impingement syndrome, things like anti-inflammatories, cortisone injections, physical therapy can all be a part of the treatment. If it's an acute injury, again, that's when I would be a lot more aggressive about seeing the provider early. So if you're lifting, your bag over a overhead compartment and suddenly it falls, or you feel a sharp pull in your shoulder, and you're no longer able to do any overhead activity, that could indicate definitely a higher degree of injury, like a rotator cuff tear. So again, I think for me, the acuteness of the injury definitely is very helpful.
But if you have that pop or that click in your shoulder, is that what's that potentially a sign of?
So again, depends on the age group that you're dealing with, and but as an in general statement, potentially it could be a labral injury, and again, the labrum is a structure that goes all around the shoulder, so there's a lot of ligaments that are attached to it. It kind of increases surface area and also provides further support through the ligaments attachments, and depending on the age group, you can injure the the front inferior lower portion of the labrum in like a dislocation, or with kind of the older individual, or even with maybe throwing athletes, maybe higher up. So sometimes these labral injuries can produce like a clicking sensation. In terms of treatment for that, it depends on the mechanism. Like in the shoulder dislocation, especially if it's a recurrent shoulder dislocation, and the patients fail like physical therapy and they always have instability in a particular position, then you might be more aggressive about offering surgical management versus if the patient is the only symptom is the click, and they have no pain or instability with that, then you would probably treat that conservatively, and at most maybe recommend anti-inflammatories, physical therapy, things like that.
What do compression socks do? That's a question that we got. Is this something that people need to be wearing when they exercise, play sports? What do you think?
Yeah, I think it's the athlete's choice. I think there are some benefits to that, especially if there's some prolonged standing involved. So the way compression socks work is that it provides compression like through a gradient to help with the venous return. So the veins are what carry the deoxygenated blood back to the heart, and basically it kind of helps with that process. So so if you're engaged in a sport with a lot of prolonged standing where you're not having the ability to sit, I think it can by improving the circulation potentially aid with recovery. So I think you'd have to try it and see if it works for individual sport. But yeah, I wouldn't say any harm in wearing it. You have to make sure that fits you well. For different body types, you have to have different sizes. So make sure that when you're buying it, they find one that's comfortable.
Yeah. So we've just got a couple of minutes left. I'm just curious, the injuries you see with sky players, are they a lot different than the injuries you see for non-professional athletes?
Yeah, again, a very good question. I would say the injuries themselves are probably not very different. The management might change a little bit because, for example, in a non-professional athlete, you may have the room for trying non-surgical management for a meniscus tear, for example, where you may say, okay, let's try anti-inflammatories, let's do physical therapy, we'll see if it bothers you, and then we'll see you back in 6 weeks to see if things get better. In a professional athlete, that would not be a great option to say, okay, let's see you back in 6 weeks. The season may be done. They may not be able to return the next season if we told them that. So in terms of the management of the injuries, we're a lot more aggressive about, how can we fix these as soon as possible, and often that will lead to surgical management. So from that standpoint, we're a little more aggressive, but the injuries themselves are similar. The management of those injuries are a little bit different.
Yeah, well, you did a fantastic job.
Thank you. I appreciate it.
Yeah, we really appreciate you being on. That's all the time we have. I want to definitely thank Dr. Athiviraham for appearing on At the Forefront Live. If you want more information about UChicago Medicine's orthopedic program, please visit our website at uchicago.org/ortho or call 888-824-0200. Thanks again for watching At the Forefront Live, and have a great week.